Hey guys, welcome back to Defeating Hair Loss. My name is Steve. Thank you so much for watching, and thank you for sending me all the information I'm getting for you about what's going on in the hair transplant world. I've got a couple texts from some viewers that were watching and wanted to enlighten me or ask questions, and they had sent me some photos, which is very interesting. And keep in mind, whenever I kind of expose what's going on in the industry, I will never name any doctors' names. I will never name any clinics' names. I will never even name any countries' names because it's not what I'm about. I'm not about kind of like slamming and saying everybody out there isn't any good or whatnot. I'm just not interested in that. What I am interested in is helping educate you so you can make an intelligent decision. So with that being said, here's what I got. I've got someone that sent me a couple photos of a doctor. Yes, he's a doctor. He's not a hair transplant doctor. This is most likely a plastic surgeon, a cosmetic surgeon, a doctor that runs a med spa. It could be a dermatologist that, quite frankly, was never trained to do hair transplants. So what does that mean? Well, that means that he's not a hair transplant doctor. And this is an advertisement, or it might be on social media. And one of the snapshots is the doctor himself, I guess, who's extracted grafts via FUE. And it's showing the extraction zone. And it says, he won't have a scar on his scalp from harvesting the donor follicles. These tiny holes will close very quickly without a scar. Okay, that is absolutely false. That is absolutely not true. Now, you're going to think I'm crazy, but I don't even hold this clinic or this doctor accountable. I don't think this guy knows anything about hair transplants. He's using a NeoGraft machine, I will say that. And the NeoGraft, or company that sold him the NeoGraft machine, probably told him this information because they want him to buy the machine, which is, I don't know, misleading, maybe fraud. It's just not good. But the doctor's not a hair transplant doctor, so he doesn't understand. He hasn't done enough cases. He hasn't seen enough results. He hasn't seen the extraction sites. He's just putting this out there. So it's very disturbing to me because what if you go in there thinking, wow, I'm going to choose this doctor in such and such a city, and I'm going to sign up for this procedure because he must do something different, that the holes in the back of my head via FUE are going to close and there will be no scars. That's what he's saying, and that is just not true. Whenever you get cut by any type doctor, whether it's an orthopedic doctor for an injury, whether it's a plastic surgeon for a cosmetic enhancement to your face or your body, whether it's a cosmetic doctor, when you puncture the skin, when you cut, you're going to have scars. So remember that. The other thing it says on here is it says the follicular units are sorted. Each unit is then placed in the areas of hair loss for a completely natural look. Well, they're showing a person without high magnification. There's no microscopes that are being used to separate the tissue. So that's not a real hair transplant clinic. They're not doing extremely articulate specialty work. We need to dense pack these grafts. In order to dense pack these grafts, we have to separate the grafts in a way which is going to take away a little of the fatty tissue. You cannot do that with even loupes. You need high magnification and microscopes. So the photo that you're going to see here exposes what they're doing, and they don't even know that they're supposed to have microscopes. Microscopes are expensive. They're very difficult to train your staff on. They need to train for at least 6 months before they're working on their other patients. So one more time, I'm not going to tell you what city this was in. I'm not going to tell you what clinic this was in. I'm not going to tell you this doctor, but I want you to see what's going on out there. I feel compelled to just level the playing field. If you have Dr. say Jones in Columbus, Ohio, that does absolute beautiful work, it's as easy as it can be, right? To just buy a machine, open up your shop, start doing hair transplants and duplicate Dr. Jones's work. It's not. This takes years of practice. This takes months and months and months of fellowships and training. Some of these doctors, and I've worked with some of them, they are not that good in an artistry standpoint. I mean, I'm not really a good artist. I wish I could play the piano. I wish I could draw like the painter guy on TV with the afro. Not even close. I'm not an artist. This guy, this clinic, they're not a hair transplant doctor. Be very, very careful. Most of the time, this is always going to come out of an FUE only clinic. Not that there's not amazing FUE only doctors in the world, but when they buy a machine and they're sold a machine by a company who's charging them $135,000, $185,000, for the artist robot, it's probably $435,000. They need to sell them that machine. And you know what they tell them? Hey, doc, you don't have to be a hair transplant doctor. What you need to do is buy our machine. And that's how you do a hair transplant. Hey, I hope this helps you. Be careful out there for what's out there. And send me in your comments, send me in your questions. And like this patient who sent this to me, if you have any suspicions, I will not expose who you are. I will not expose who the clinic is. I want to help you. I want to educate you. And then you make the decision. The title of this video is going to be Buyer Beware. Don't forget to like and subscribe.